Senator Giesel, under debate.
Thank you, Mr. President. Senate Bill 169 presents a public-private solution to an expensive but important health issue in our state. It creates a vaccine council that will administer a statewide universal immunization program in Alaska. So a little background on this. Back in 2012, I introduced a bill that was a temporary solution to this. The problem arose when our U.S. Senator Ted Stevens left the U.S. Senate. Ted was very focused on health of Alaskans. He focused on clean water in rural Alaska, health clinics, and provided funding for a universal vaccine program. In other words, all Alaskans could receive vaccines at no charge, just what the provider charges for a vaccine. Well, that went away. And our funding from the federal government went from $4.3 million down to a mere $700,000 by this year, and actually is dropping even more. So my bill in 2012 presented a 3-year solution using state money, $4.3 million per year of state money. I meant that only as a temporary solution, Mr. President, because other states have found a more permanent, fiscally responsible solution. So that's what this is today. That solution has been reached. Negotiations have been going on for the last 2 years, and so 1 year early, we are arriving at a solution. This bill provides or creates a vaccine assessment council. On pages 2 and 3 of the bill, you can see that council, you can see the composition of it and how it would function. It will be under the Commissioner of Department of Health and Social Services. It will not be under boards and commissions. In other words, we are not enlarging state government. The folks on the board or on the council will serve at no compensation. They'll use the staff from the Department of Health. Each entity in our state that provides health care, so insurers, tribal agencies, private health clinics, health plans, all can join into this council, and they will be assessed based on how many vaccines they think they'll be using. They'll be assessed a fee ahead of time. The state will use then its buying power to buy in bulk from the federal government at the lowest possible cost for these vaccinations. Vaccines are incredibly expensive. You might pay $5 for a flu vaccine, but the actual cost of the vaccine itself may be $105. All you're paying is an administration fee, Mr. President. So this will allow this universal application to continue to go on. Right now, with the very small federal funding, we have vaccination provision for Medicaid kids and for a few adults that qualify, but the vast majority of Alaskans are not included. This bill will include all Alaskans. You see there are 2 flyers on your chart, on your desk that is. One is a bubble chart, shows how the process will work as the insurers are assessed a fee ahead of time. They've actually asked to be assessed quarterly. They will put money into this council designated fund. That council then will purchase these vaccines and distribute them around the state. We already have this in place because under Senator Stevens, we had a universal program in place. It will be for children and adults. On the next page, you have a pyramid that basically shows how the assessment will work. This is working well in many other states, and we have universal support here in the state. We've got numerous letters from healthcare providers who are very excited about this, mainly pediatricians, but also adult providers. And on your desk is a letter from a New Hampshire pediatrician. He serves on the New Hampshire Vaccine Association. That's their version of this bill, and he documents that New Hampshire has saved $45 million over the last 11 years of having this program in place. So this is an innovative solution. This is exactly what I intended 2 years ago. I'm very thankful that we've been able to put this together, and I would urge a yes vote on Senate Bill 169.
Thank you, Senator.